Hi, I'm Debbie Roman, and welcome to another edition of In the Know at Cummins. Joining me today is Erin who's a therapist here at Cummins Behavioral Health, and she's also a substance use disorder specialist, and we are going to talk about the IoT groups. So welcome, Erin.
Thank you very much.
Okay, so what is IoT and what does it mean?
So IoT stands for Intensive Outpatient Treatment.
Okay, so what is the purpose of IoT?
So the purpose of IoT is to learn how to live life substance-free.
How long is each group and how long is the IoT process itself?
IoT is 3 times a week for 3 hours, and there is no set number of sessions that one is required to complete. It's individualized and based on progress.
Okay. What is taught or talked about in the IoT groups?
So there's a big misconception that I've heard from individuals in my 15 years of facilitating group, and that is, we're just going to sit around for 3 hours and talk about drugs and alcohol and how it impacts us, physically, mentally, emotionally, and spiritually. And that is somewhat true. We do talk about substance use and misuse and how it does impact all areas of our lives, but we're also talking about trauma, relationships. How does our substance use impact ourselves and our loved ones, employment, legal discord issues. And so really it's about coming in and talking about whatever's on your mind so that we can work through what's going on. And we even talk about celebrations as well.
Great. So how is it determined that someone needs IoT?
So an individual will first come in and engage in an initial assessment. Within the initial assessment, we conduct what we call an ACM assessment, which stands for American Society of Addiction Medicine. And when that assessment is conducted, depending on the number that is computed, will determine the level of care that someone will need and is recommended.
Okay. What is expected of someone in IoT?
So there are probably many expectations of an individual coming into IoT, and I'm sure that an individual coming in for the assessment and then getting oriented into IoT is probably overwhelmed with a lot of you shouldn't do or you can, but really what we're talking about is 5 core values, recovery values, which are honesty, respect, open-mindedness, willingness, and self-care. A lot of individuals are apprehensive about coming in because we're asking them to give up their sole coping mechanism, which is their substance. And so, can you imagine living life without your one comfort? And we ask them to do that. We say, no, you can't have it anymore. And so there's a lot of fear surrounding that. And so we just ask them to come in. Let's be honest, we're going to work through this and teach you some other skills so that you can learn to live substance-free.
So what if there are any costs, what are they?
So there are costs to IoT services, but we have many payer sources. So we will accept Medicare, Medicaid, Department of Child Services, insurance, and then we also have the option to discuss sliding scale fees.
So can you refer a family member or a friend?
Absolutely. I would encourage anybody who has a loved one or a friend or just an individual that you may have concerns that they're using substances or impacted by their substance use to talk. The disease of addiction really doesn't want people chatting amongst each other. They want to kind of keep it isolated and not chatting. So open up the discussion and give Cummins a call, and we'd be more than happy to walk you through that process.
Great. So what advice would you give someone who's hesitant about these services?
So, I have lots of advice because I like to talk, which my group will probably tell you I never stop talking. However, my one piece of advice would be just try it. just try it, come into group, and see if you like it. If you don't like it, then we can have a conversation about it. The feedback I hear the most after someone's completed IoT is, Erin, it really wasn't that bad.
That's great. Well, thank you so much for joining me today. And
Thank
if
you.
you have any questions about these services or any services we offer here at Cummins Behavioral Health, just give us a call at 888-714-1927 or check us out on the web at cumminsbhs.org. Thank you.